Hello, Dr. Marshall here with Medical Specialty Clinic, and today I wanted to discuss allergies and some things that you can take to help you deal with those things. It is Easter weekend here when I'm recording this, so allergies are full on for a lot of people. Just went outside yesterday and my car was covered in pollen, so a ton of people are dealing with allergies right now. I'm seeing it in the office and obviously seeing the results of everything blooming in the environment here. So wanted to go over a few things, give you some ideas of some things you can do to help with those and hopefully keep you out of the doctor's office. So first off, allergies typically are mediated by histamine. So your antihistamines are going to be first step treatment, and good old Benadryl or diphenhydramine is one of the first options that most people go to, although it can make you a little drowsy and some people can't take it, especially kids with ADHD. A lot of them, they take Benadryl and they just get real wired up. So some alternatives to Benadryl would be the non-sedating antihistamines. So the reason that they cause you to be drowsy, or that some antihistamines cause you to be sleepy, is that the diphenhydramine will cross over the blood-brain barrier, get into the central nervous system, and blocking histamine in those areas of the body make us very sleepy. However, blocking the histamine receptors in the peripheral areas of the body make us less likely to have the histamine-mediated symptoms of runny nose, swelling, congestion, things like that, scratchy throat, a lot of drainage, cough sometimes to get that stuff back up. Those things increase mucus production basically from histamine-mediated response in the peripheral body. Blocking that will decrease that. And then blocking the histamine in the central nervous system actually makes us very sleepy. So they actually were able to produce some antihistamine medications that do not cross over the blood-brain barrier into the central nervous system. And those are the non-sedating antihistamines. So that's going to be your brand names like Claritin, Allegra, Zyrtec. There's a few others, but those are the big three, and they are all over the counter. The generics for those are going to be, let's see, for Claritin is going to be loratadine, and that's a 10 milligram tablet once a day. The Zyrtec is going to be cetirizine. I think that's also 10 milligrams a day. And then Allegra is going to be fexofenadine. Sometimes you take one for a little while, a few weeks, and it seems to stop working. Sometimes switching to a different one can help get you some more benefit out of it. So some people do cycle between those. So I wouldn't stick with just one. And certainly if one kind of quits working, I would definitely give another one a try. After that, there's some prescription things like steroids and things like that. But if you want to stay with non-prescription medications, just over-the-counter stuff, I'm going to give you some extra ideas here that you may not have thought about other than just the antihistamines. One big thing that most people can do, especially if you're having a lot of nasal symptoms, is nasal rinse. So just nasal saline, moisturize the nasal passages and wash that stuff out. So wash all the stuff that's hitting those receptors and causing the allergies to go away. So just wash that out. So nasal rinse, you can do that several times a day if you need to. There's the most popular one right now is probably the neti pot, but there's Navage and some other systems that can help with nasal rinse. But there's the simplest one is just mix up a saline solution and then pour it in one nostril and let it run out the other. There's a good technique for that. I'll let you look up how to do that on your own. But if you want, I think Neti makes some squeeze bottles. They obviously make a Neti pot. And then Navage, which is like a power wash system for the sinuses. Those are all fairly neat. Some people tolerate them, some people don't. But if you're interested, one of those might help you. And then the next step, if it's a lot of nasal stuff, would be a nasal spray, a steroid nasal spray. The typical one, the most common one is probably Flonase. There's a few other brands, but that's fluticasone, and that's a steroid. It goes right to the nasal passages where it's needed, where it can work, and you don't get all those long-term side effects from like an oral steroid like prednisone, things like that. Those are fine. You can take those forever. They won't really hurt anything. Anytime you do a lot of manipulation of the nasal passages like saline or Flonase, you can have a risk for a few more nosebleeds, but usually if you stop using those things, that goes away. And some people, it actually helps prevent nosebleeds because of the congestion and things like that. Can be different for different people, but those are usually good staples. An antihistamine, steroid nasal spray, and then a good nasal saline rinse. And then gargling with salt water, make a salt water solution and gargle with that, warm salt water. That can help clear out a lot of stuff. And for most people, that will get the job done and help a ton with allergies. And you can do that as needed or regularly. Those things can be done long-term. No long-term side effects, at least not that we're aware of right now. You can find some of these rare side effects from any of these things, but in general, I would not be concerned about taking these things long-term for myself if I needed them. So then a couple of other things that you might want to look at are things like quercetin, bromelain, stinging nettle, vitamin C, echinacea, and N-acetylcysteine actually can help. So the first thing I'd like to discuss is quercetin. It is a powerful flavonoid. It supports healthy histamine levels. And then there's bromelain, which enhances the absorption of quercetin. So taking those together can help. It also supports mucosal tissue health. Stinging nettle is another thing that can help, and stinging nettle leaves balance the hyperimmune response. And then there's N-acetylcysteine. This can help clear the airway of mucus by promoting normal viscosity of mucus. All these things together can be a powerful combination and really promote healthy nasal and sinus passages. Quercetin is a biologically active flavonoid antioxidant. It's widely distributed in plants, including oak trees, onions, and tea. Quercetin has strong antioxidant activity and has been shown to support immune health by mediating the release of inflammatory compounds, including leukotrienes and prostaglandins. Quercetin is known for its ability to stabilize mast cells, which are highly involved with the allergic response, and then that diminishes the release of histamine, which causes the majority of seasonal allergy symptoms. Now, I mentioned leukotrienes. So leukotrienes are another mediator of allergy response or allergy symptoms. And there is a prescription medicine that blocks leukotrienes, and that would be Singulair or Zafirlukast. Now, there are a couple of other leukotriene blockers, but that is the one that people are most familiar with. But that is also an option. But again, that's going to be prescription. On the other side of things, it's important to at least consider leukotrienes in addition to histamine. I don't want you to think that histamine is the only thing that's really causing the trouble as far as symptoms. So next is stinging nettle leaf. So this is a plant that's been shown to balance the immune response, specifically in the airways and nasal passages. Studies have shown that the extract of stinging nettle leaves balance a variety of inflammatory activities that affect respiratory health. Stinging nettle leaves control mast cell degranulation, or that's the release of histamine, prostaglandin formation, and histamine action, which all contribute to a balanced inflammatory response, not that overdone hyper response that causes all the trouble. So next up is bromelain. Bromelain is a plant enzyme naturally found in the stem and fruit of the pineapple plant. Bromelain is a proteolytic enzyme that aids in the breakdown of large protein complexes, including antigenic compounds that are causing the trouble. And this has been shown to also enhance the absorption of quercetin. So again, good combination. Bromelain reduces circulating allergenic protein complexes and decreases allergy symptoms in general. Next up is N-acetylcysteine. N-acetylcysteine, or NAC for short, is an amino acid precursor to one of the most important antioxidants in the body, glutathione. I actually have a video on glutathione if you want to check that out. I'll try to put a link in the description to it. But both glutathione and N-acetylcysteine help reduce the mucus viscosity and help maintain clear airways and respiratory. Next up, vitamin C. Most of you are probably familiar with that. Humans are not able to synthesize vitamin C, and therefore it's an essential nutrient that must be consumed in our diet. Among its numerous health-promoting properties, it is an essential vitamin that particularly supports the immune system and is also a potent antioxidant. When the body's under a significant amount of emotional or environmental stress, vitamin C is excreted rapidly. So vitamin C replacement can help boost immune properties and can be distinctly beneficial for a lot of people, especially with allergies and an overabundance of histamine-mediated symptoms. I hope this helped. Just a quick few items. There's obviously a ton more things that you can take over the counter, but I wanted to mention a few in a short video here, get you some information about them so you can do your own homework. And as always, if you want to learn more about any of these supplements, or if you're having troubles with allergies, a lot of mucus production, chronic cough, things like that, give us a call, make an appointment, talk to one of our providers. If we can't help you out, we'll get you to somebody that can. Don't forget to like and subscribe. Thanks for tuning in, and we'll see you in the next one.